Video 3 on what you do when you find a lump on your dog and it is diagnosed as probable or suspected cancer. So in our real life example of our family dog, Tango, the veterinarian said, okay, let's take off the lump, surgically remove it, and send it off and get it biopsied and evaluated by a pathologist. So what's the problem with that recommendation? The problem is the suspicion of a mast cell tumor. So a mast cell tumor is a type of round cell tumor, very common in dogs, and it is full of histamine granules. And basically the treatment for it is wide surgical excision. Older recommendations have recommended as big as 3 centimeter lateral and deep margins. And that doesn't sound like a lot, but it's really, really big. Basically, this lump is on the leg, and if you've ever looked at a dog's leg, there's not a ton of tissue there. So it is almost impossible to get good margins on a mast cell tumor that is on the limb. So basically, the surgery to send off the lump for biopsy would almost be like a salvage procedure or palliative procedure, because there's very, very little chance that you would get good margins if it was a mast cell tumor. And in oncological surgery, the first surgery is your best chance for cure. So you don't want to have to go in a second time for an additional surgery, because chances of good outcomes are much, much lower. So my recommendation, if people are willing and able to afford it, is actually to send off that fine needle aspirate to a pathologist to get that diagnosis confirmed. Because basically, if it is confirmed that it is a mast cell tumor, they are often able to grade it to a certain degree, so to see how aggressive or severe it is. And it really helps guide our treatment choices, because there's a couple of other types of masses that can kind of look like mast cell tumors, including histiocytomas and a couple of other different things that aren't nearly as scary as a mast cell tumor. So best case scenario, it gets evaluated by a pathologist and it's actually benign. So then you don't need to get big margins at all. So you could have a much smaller surgery. Or if it actually is mast cell tumors, we need to talk about all the different options, whether that be amputation, palliative, or, having narrow margin removal of that mass, or something like a Stelfonta injection. Moral of the story, send it off before you do surgery.